have a text from a gentleman named Danny. He's 30 years old. He's 5'11" and about 145 pounds. He is having very sharp pain in his chest, and he gags, usually from brushing his tongue. The pain is so insanely intense, he says, it's off the scale.
Okay, well, first things first, stop brushing your tongue because you really don't need to be gagging. Okay, if you're worrying about oral hygiene, we can worry with that after we figure out why you're so underweight. Now, there are other things that you have to start considering, one of which is called celiac sprue. Okay, celiac sprue is a more severe form of gluten enteropathy. And so what will happen is you'll end up with gastritis, enteritis, colitis, all from celiacs. So first thing I would do if I were you would be to cut wheat out of your diet and see how you go. The second thing is corn, because there's a subset of the population that can have corn gluten allergies, me being one of them. Okay, but if you have the gastritis that goes along with this, anything that stimulates the stomach to contract is going to cause you intense pain. So keep your brush off of your tongue for the time being. If you really feel the need to do it, numb it up with a little Chloraseptic first, okay, to inhibit the gag reflex, but don't brush it to the point where you gag because you may start bleeding. There's something called Boerhaave syndrome, okay, which will occur in individuals that have gastritis, actually notably from alcohol. Boerhaave was an interesting observer back in I guess it was the 16th century, where these folks were drinking too much, making themselves puke, and then they would end up bleeding to death or developing esophagitis from linear tears of the esophagus from the heaving. So stop doing that. It's a bad idea.